As we go in this series of how to be empowered, we happen to have a guest with us today, Dr. Ruth Pickering, who's a retired child psychiatrist. And I began to think, well now, what can we all do about the children that are around us, whether they're our own children, children in the school system, at our church, where we work, whatever it is, what can we do to help them to be empowered? And I'd like to ask Dr. Pickering to just speak to you about what can we do and what is, like, where do we start? What helps a child to become the best they can be? And you've seen mostly troubled children because they come to you.
That's right. Well, I've had 40 years of experience now working with troubled children and their families. And one of the things that's become very clear is that increasingly in our society we're looking at these children with kind of a monocular vision. That is, we see them through a lens of deficit and disorder. Certainly the field of child psychiatry has moved in this direction, I think unadvisedly, so that when a child is struggling, we see that child as having a behavior that then needs to be treated. And in child psychiatry, increasingly we're diagnosing those children with disorders without examining the conditions of their lives. If your view is broadened, then you begin to see how important supportive families is. Many families generations ago had the support of either a small community or the extended family. Many mothers are supporting their children on their own with inadequate finances, and so they need more finances, but they also need community to be there for them.
Yeah, that's right. Whether we realize the importance that we play in the single parent family, that they're not alone, and the children don't feel alone. They feel loved by outside sources.
That's right.
Yeah,
that's right.
Proper food, whether the kids are getting exercise of any sort, whether they get outside to play or whatever. Of course, we're in the nutritional field, so often we see if a child can be fed really healthy food and they also can be taking a good supplement, that takes the place of some of the food that's maybe missing, and maybe an imbalance even just in their nutrients in their body.
And then all of the other areas, medicine is important, nutrition is important in your field, and some of the other, what we in the medical field call paramedical specialties, like massage and chiropractic and so on. Those, I believe, all have a place in the full health of children and members of the community. And I think we make a mistake in thinking that medical people are the only experts around. And as a profession, we have not worked as closely with other areas, other professions, other skills that are attempting to contribute to human health and welfare.
Good, yeah. Whoa, I wish she was staying with us a little longer. We could do a whole series.
Oh, we could do a whole series,
Well, consider who you might be able to help in the young crowd that you happen to bump into in your day, whether it's your own children or other people's, that you can play a part just by encouraging them, by perhaps helping financially in some way, providing food, nutrition, whatever it is. And let's empower our young people so that they grow up to be strong, healthy, happy adults. So you have an empowered day too. We'll see you again soon.